Saturday morning, we kick off the Experts program here on Power Talk Radio, 1460 and 101 FM, and Luis Alvarez, CEO of the Alvarez Technology Group, joining us today. Good morning, Luis.
Good morning, Mark. How are you?
Doing pretty good. I guess our topic today is how the coronavirus crisis is permanently changing our lives already. What do you have to add to that? I'm sure that being on the technology side of things, we are all really leaning heavy on our use of technology to keep our economy going.
It's interesting. A lot of negative stuff is happening, obviously, with the coronavirus and the stay in place and all these other really crippling effects on our economy. But some good things are going to emerge from it. For example, I think the idea that people working from home used to be something that employers were very uncomfortable with. They looked at it as a way for employees to shirk their office work and, how can I manage them remotely? How do I know they're doing their jobs? And one of the things that we've already discovered in a very short period of time is that people are much more productive at home than they are in the office. We've heard that from a number of our clients who say that the lack of distractions, the lack of need to get up and go, talk to somebody at their desk means that you're getting more done in a shorter period of time.
Right.
And people can be more energized about working from home.
Well, Luis,
I think that's here to stay.
It really is here to stay. And I was just thinking as we were starting this conversation, how are you doing this? You and I connected over the internet. Now, 50 years ago, we could still do this over a telephone. You and I, what we are doing, we couldn't do half a century ago. But everything else we do and the rest of the American economy, my gosh, if we had had this coronavirus outbreak in 1970, we'd all be dead. The economy would be completely destroyed because there would be no way for people to telecommute or work while sitting at home. It's devastating today, but imagine where we would be without technology.
The fact that about 70% of the work that is done today in our country is information worker related.
Right.
We generate information, we work on computers, we do those sorts of things, as opposed to in the 70s where it was largely a manufacturing focused economy and those people couldn't work. As it is, you're seeing the auto companies laying off people and stopping production because they're trying to avoid the spread of the virus. It's going to have an impact, of course, but not the kind of impact it would have had in the 70s.
Right. And of course, now we're seeing, and I was listening to the President's White House daily briefing yesterday on Friday, and they were talking about the fact that General Motors, for instance, has said, hey, listen, we can change production. We can shift production and make ventilators. We have the industrial capability to do that. Ford and Fiat Chrysler has indicated the same. So just as they made half-tracks and tanks and all sorts of war vehicles during World War II, they can gear up for that again, and they can keep their people employed and at the same time really do a lot to help us through this. But it really is, even when we get through this, Luis, this is a real wake-up call, I think, for everybody. And I don't know how it's going to change our lives permanently because we haven't gotten there yet. We won't know until we're through this and how our attitudes change. Is everybody's attitude going to change? No, but I think significant numbers of us to make a critical mass. The way we look at things, the way we approach things are certainly going to change. I think one thing that is definitely going to change is I think there's going to be a level where the American people are going to become more engaged in certain issues regarding trade and manufacturing and where critical supplies are produced. And I think we're very much going to have a, kind of a community town hall meeting, the old come to Jesus kind of thing with our elected representatives and our business leaders and saying, look, making stuff for the cheapest price can't be the only thing that motivates us in business. We have got to produce critical supplies, particularly medical supplies in this country, so that we're not in a situation where we start talking about all these things and people say to us, well, the vast majority of the base elements for our medicines are all made in China. Well, that's ridiculous. Why on earth would we ever let something like that happen in the first place? We don't produce 90% of our food outside of our borders. On the face of it, that would be patently ridiculous and dangerous. We all recognize that. And I think that there's going to be a new level of engagement that people are going to have and a level of accountability that we're going to want to see from our elected officials and our business people. And I think we're going to use technology to make that point to them.
I think that we are going to have to take a long, hard look at how our supply chain has really become this global thing that we have very little control of. When China was doing their lockdown at the beginning of the year, the supply chain was impacting everybody around the world because so much of the goods that are sold in Europe and in the United States and Central and South America come from China. Mm-hmm. And they were shut down. They weren't making anything anymore. Now they're making a bunch of stuff. We just don't need it right now. So, right. But I do think one of the other things that's going to be positively a positive that comes out of this is the explosive use of telemedicine and telehealth. Mm-hmm. You know, that the capability has been there for a long time, but there's been a reluctance on the side of doctors to do it because they feel that it's it's not the kind of medicine they want to practice. They can't see you or talk to you the way that they would if you came to the office. And on the other side, the insurance companies and the government were really hesitant to pay for services like telemedicine, thinking that this could be easily a scammed thing. And so Medicare didn't allow it except in very extreme cases, and health insurance didn't really pay for it unless it was a specific type of thing. Well, now telemedicine and telehealth is how doctors are interacting with people to determine if they have symptoms of coronavirus and to avoid them having to come to the hospital. And a bunch of doctors that I've talked to are pleasantly surprised with the ability of the interactions that they have with their patients because of the technology, because of webcams, because of all of these tools that are available now that to collaborate. And so it's not just picking up a phone and talking to a patient. You can actually see them. You can say, hey, hold your arm up. I want to see that spot that you're complaining about. Mm-hmm. And you can do a lot of things remotely and be much more efficient and effective. And I don't think we're going to go backwards. I think this is just going to be the beginning of this new world of healthcare that might conceivably help drive down the cost of healthcare because it will eliminate the need for building a bunch of facilities for people to have to come to.
Right. That's a great point. And we've talked so much about it. And I remember when we were having that conversation over a decade ago about how do you bend the cost curve on medicine, which was really outpacing the rate of consumer price index of general inflation. And this is maybe one of the ways you have to use something like telemedicine to bend that cost curve down so you can get a handle on it. And at the same way, you can save some money. You can serve more people on the same dollars and get excellent results for them. And, that's really kind of the name of the game.
I agree with you. And I think that a lot of the things that are being developed in terms of how we can keep people gainfully employed while working from home will continue to be used going forward. And another area that I think people are going to really start using more frequently, even after this is all done, is delivery services for food and for groceries. Mm-hmm. A lot of them have been trying to avoid going to the store, so they've been using things like Uber delivery services and delivery services that are offered by grocery stores and finding that it's an effective way to get what they need without having to stop by the store all the time. I think we're going to see that stick around after this crisis is over.
What about the change in education? We are seeing even our public universities, public colleges at all levels are investing in distance learning where students are taking their classes over the internet. They might just be using a notepad or their phone or a desktop computer at home or wherever they happen to be. But we've talked a long time about higher education is another area where the cost of it has far exceeded that of the general rate of inflation. And getting a handle on the cost of public education is something that is very, very important to us as a public policy issue. Maybe we're going to see some of these barriers that are really kind of institutional biases against the use of distance learning. Maybe we're going to see some of that start to fall away as we see that this is going to be a new way of doing things. And because building new buildings on campuses is a really expensive way to accommodate the growth in public education. And if you can do more of it over the internet, why would
I agree with you entirely. I think that this experiment where you're seeing schools at all levels saying basically we're not coming back to the classroom till the beginning of the fall term. That means that these kids, even when the coronavirus crisis kind of starts to dissipate in a month or so, hopefully, you're going to see education still happening and you'll see kids learning and you'll see college students continuing their studies. Then we'll have the question, do we really need to have all of these shiny new buildings in these college campuses that cost a lot of money that drive the cost of education up when students can learn remotely?
Well, we do because the faculty union says yes.
Yeah. Well,
I don't mean to be flippant, but I mean, that's one of the institutional bulwarks against creation of more distance learning. But eventually that's going to have to fall away because really it's the wave of the future. It's where things are going. And it doesn't mean that we're never going to have, we're not going to have brick and mortar schools. We will. But, we're going to get to a certain point where the public is just going to say, we can't be spending $1 billion on building new colleges in California or anywhere else when, quite frankly, we could have the capacity on the existing brick and mortar campuses if we invest more and a lot less money in distance learning and we handle the surge in enrollment that way.
I think you're going to see distance learning be an option for a lot of people. Mm-hmm. And if I was a college, I would see it as an opportunity to grow my student population without necessarily having to incur all the costs of building new buildings.
Right.
And if I charge a little less, kids get the same education, but I don't have to build anything more. So all the money is in the bottom line.
Luis Alvarez, CEO of the Alvarez Technology Group, has been our guest this weekend to kick off the Experts program. We'll chat again Monday morning with Luis. Online, alvareztg.com, @AlvarezTG. That's your Twitter handle. And Luis, the toll-free number for that great I-Team.
Please give us a call at 866-78-I-TEAM. That's 866-784-8326.